انا بس حابه ارحب طبعا بضيوفنا. انا بس كنت مستنيه الجزء الكلينيكال يخلص قبل ما نبتدي السيشن اللي هي الاساس اللي هي الراديولوجي. الاستاذ الدكتور حسن الكيكي طبعا استاذ الاشعه في طب القصر العيني، وهو يعني هو نقدر نقول عليه الفاذر جاد اوف بيدياتريك راديولوجي. الاستاذ الدكتور عز عبد الحميد استاذ الاشعه بكليه طب جامعه قناه السويس، اهلا بيها طبعا. صديقي واخي الاكبر الاستاذ ولا الاصغر الاستاذ الدكتور ياسر مظلوم استاذ الاشعه بكليه طب اسكندريه، وطبعا البايونير في البيدياتريك راديولوجي بالذات النيورو دكتور استاذ الدكتور خالد عبد الفتوح. نبتدي بقى الجزء الراديولوجي معانا. دكتوره سحر تقدم لنا بقى.
لا انا هحاول من هنا، مش هو كده.
اختي بقى او بنتي دكتوره داليا الموسلي approach neurological emergencies in children imaging perspective. هكمل البازل.
Good morning. Thanks my dear professors for inviting me here. I'm Dalia El Mossly, lecturer of radiology at Shamsi University. My talk about imaging of brain emergency in pediatrics. Pediatric brain emergency includes seizures, loss of consciousness, neurological deficit, and trauma. When reading CT scans of the head in emergency department, you are looking for acute and often obvious defects. Having a systematic approach to look at CT scans of the head will help you to read it more efficiently and never to miss any neuropathology. Like ABC. A is for airspace, B, bone, blood, brain, and C for cisterns and CSF spaces. A is for airspace. Looking for the air in the paranasal sinuses, like ethmoidal air cells and sphenoidal sinuses. There is a pathology when there is a fluid where there should be air, or air where none should be found, or there is discontinuity in the wall of the air spaces. The pathology could be infection or fracture. B is for bone. The question is it suture or fracture? Look at the normal sutures on the opposite side. A matched defect may be a suture, while an unmatched defect is likely a fracture, like here. This is an unmatched defect of a fracture. B is for blood. Epidural hematoma or extradural hematoma. The outer surface of the hematoma is convex, and the convexity of the hematoma is like the convexity of an eyeball. It doesn't cross skull sutures. While subdural hematoma, the outer surface of the hematoma is concave, giving the appearance of crescent moon. It crosses skull sutures. The subarachnoid hemorrhage, where the blood, the hyperdensity within the brain sulci, it gives a spider appearance. The common cause of subarachnoid hemorrhage is secondary to ruptured aneurysms. Other causes include trauma and tumors. Therefore, secondary survey of CT cerebral angio is a must. Here is a case of subarachnoid hemorrhage, and in CT cerebral angio, it showed a ruptured atrium aneurysm. In MRI brain, T1 and FLAIR sequences, there is a hyperintensity within brain sulci giving EV sign, and it shows blooming artifact on T2 star. Neonatal germinal matrix hemorrhage. In transcranial ultrasound, it shows hyperechogenicity within the germinal matrix. The grading of germinal matrix hemorrhage: grade 1, when the hemorrhage is confined to the germinal matrix; 2, intracranial extension involving less than 50%, while grade 3, intracranial extension more than 50%, or there is dilatation within the lateral ventricles. Grade 4, there is intraparenchymal extension. In the intraparenchymal hemorrhage, in your report, you should include the following data: the size of the hematoma, location of the hematoma, edema mass effect, and intraventricular extension and hydrocephalus, and also brain herniation. In this case, there is a left large frontoparietal hematoma. It shows mass effect. It's surrounded by edema, brain edema, with intraventricular extension. There is effacement of the ipsilateral lateral ventricle, dilatation of the contralateral side, and it shows subfalcine herniation. B is for brain. You should look for effacement of brain sulci. Ventricles should be symmetrical. The falx cerebri should be in the midline, and you should look at the gray-white matter differentiation. This is a normal CT scan of the head, where the ventricles are symmetrical and the cerebral sulci is in the midline, and also there is preserved gray-white matter differentiation. The case of subdural hemorrhage, there is effacement of brain sulci, midline shift, and there is effacement of the ipsilateral lateral ventricle, subfalcine herniation. The case of diffuse brain edema, where there is a diffuse effacement of brain sulci, loss of gray-white matter differentiation. Note the cerebellum appears to be hyperdense comparing to the surrounding brain parenchyma. It shows wide cerebellar sign. At last, C is for cisterns and CSF spaces. You should look at the supracellular cistern, which appears star-shaped in the location of circle of Willis, circummesencephalic cistern, which is a ring around the midbrain, and quadrigeminal cistern, which gives a smile-shaped appearance. Our take-home message: when you look at the systematic approach in CT brain, you will never miss in neuropathology. A, B, C, A, air space, B, bone, blood, and brain, and C for CSF spaces and cisterns. Thank you.
احنا يا جماعه يعني نوقف ربع ساعه بس